It's preparing to live stream right now, and then I'll get record going.
Okay.
Okay, we are good to go.
All right, thank you, Mike. We're going to go ahead and call the Kent City Board of Health meeting for November the 10th to order. It is 5:36 p.m. on the 10th, and we'll go ahead and ask the secretary to call the roll of the members.
We'll start with Jack Amorine.
Here.
Michelle Frederick.
Here.
Louise Frederick.
Here.
Emily Mattern.
Here.
Chris Wolverton.
Here.
Pam Ferguson.
Is there a motion to excuse Pam from the meeting?
I moved to Pam.
Okay, is there a second? So Emily and Jack, thank you. Any discussion on the motion? All in favor, aye.
Aye.
Opposed? Hearing none, motion carries. Thank you.
Then for guests, I believe we have Dr. DeJulius, our medical director.
Yes, hello.
Hi. And then Rose Ferraro, Director of Nursing from Portage County Health District.
Hello.
And I see two other names on the list.
Yes, Gwen here?
Yes, I'm here.
It's Gwen Rosenberg. And anyone else?
Hello, my name's Taylor. I am a Kent State student and I'm attending for a class.
Welcome, Taylor.
Okay, great to have you with us. Okay.
Okay, so pre-meeting, we discussed the possibility of rearranging the agenda to accommodate those that have to leave early. So is there a motion to approve the rearranging of the agenda as discussed?
I motion to approve the rearranging
Thank you,
agenda.
Michelle, a second?
Second.
Thank you, Louise. Any discussion? Hearing none, all in favor, aye.
Aye.
Opposed?
Aye.
Hearing none, the motion carries. So we'll go ahead and read the minutes, do the open comments, and then we'll be sticking reports, letters C and D up right after that. Okay? So you've had a chance to review the minutes of the last meeting. They're in your packet. Is there a motion to approve?
I motion to approve the minutes from the October meeting.
Thank you, Michelle. Is there a second?
I second.
Thanks, Emily. Is there discussion on the motion? Any corrections, additions? Hearing none, all in favor of approval of the minutes? Aye.
Aye.
Opposed? Motion carries. Thank you. We're going to open the meeting up to guests. Gwen and Taylor, feel free to take this opportunity to speak to the board.
Thank you. Which of us should go first?
Taylor, you have anything? I got the sense you're just sitting in for your class.
Yeah, I'm just sitting in and writing a little bit about what's happening and just observing.
Okay, so do you have anything you'd like to say to the board?
I am good right now.
All right, thank you. Gwen, it's all yours.
Oh, thank you. Thank you very much for having me. I appreciate it. I just wanted to weigh in as a small business owner and respectfully ask the board to reconsider increasing the fees for food businesses. I completely am impressed and so pleased with the work that the health department has done during this pandemic. Unfortunately, for small businesses like mine and food service operations in the city, it's been tremendously difficult and challenging. And I'm certain that there are businesses that are right now making decisions about the future and whether they'll continue to operate, whether there's enough revenue to do so. So I would just like to just offer my 2 cents and respectfully ask that if there was some way to possibly postpone increasing the fees, it would be greatly appreciated, not just by businesses like mine, but other businesses throughout the city. And also if there's any possible way to perhaps scale some of the fees more so in terms of square footage, so that the very small businesses aren't paying the same amount that significantly larger businesses are paying. It's just in the interest in fostering a sense of welcoming to very small businesses, locally owned businesses, mom and pops and things like that, that would be suffering more so during this pandemic. So those are just my 2 cents, and I really appreciate the opportunity to speak to you. So have a lovely evening. Thank you.
Thank you, Gwen. We certainly will take it under advisement.
Hi, Gwen.
Justin, I do apologize. You're off to the other side of my viewing area, and I didn't recognize you as our guest, so my apologies. We'll go ahead and mark Justin Smith as another
I
guest.
am here. Thanks.
Thank you. Rose, how are you tonight?
I'm doing well. How are you guys?
Doing well, thank you.
Everybody staying healthy?
Thank you. Yes, hiding behind a mask.
There you go. We like to hear that. Trust me, we like to hear that.
I stuffed mine with extra filters just to help it be more of a protection rather than just a protection for other people.
Oh, that's good. Yeah, some of the masks you could put 2 masks in. So I have a nurse that's really can't wear the N95 because she just breaks out. I mean, her whole face is red within an hour. So she does the 2 masks.
Yeah.
And I figured that at least that's better protection than just a single mask.
Yeah.
And then we have our cloth mask, but we put a mask in between the cloth. So we do that too. So especially now.
Yeah, the one that she would normally use, this is what I've been doing. The N95 material, you can cut as a rectangle and stick that material in the cloth mask.
Right.
So
We have those, yeah, the KN95 too, which is a little bit better. It's not as rigid. You look like a duck, but it's okay. We're okay with that too.
Right.
Yes.
Okay,
So,
Rose, you're on.
Okay. I hope everybody got the nursing report. Sorry, it's was late, but we have been really slammed with COVID cases. So saying that, we've seen a really high increase in our cases. The highest caseload was on November 7th and 8th. We have 53 cases per day. It has not really gone down a whole lot. Today we had over 47. So we're burning through our contact tracers more so and more so. They're just really getting burned out. We do have 2 contact leads right now, and they actually assign our cases to our contacts, which then they go ahead and run with them. We still are meeting weekly with the schools just to make them understand what we need from them as we go ahead and report that to Ohio Department of Health. We are trialing some new things that we want to with the schools. So what we have done in the past is we would give them a letter for every contact we had. So if it was a contact or an isolation case, they got one at the beginning and one at the end. We are doing away with that and just giving them a line list because it's taking too much time, because we can have one confirmed case at a school and have 54 to 65 contacts. So it's making it really rough that we're having about 400 to 500 kids in quarantine versus only 10 kids in isolation. So we're trialing some different things, and we're working with Penny, and she's guiding us along, so that hopefully that will continue. We're still in incident command. As a matter of fact, the hospital just reached out and said they are going to be going into incident command too. They are starting to see an increase as we go forward. We've continued with our immunization clinic. We're going to try and continue with that right now. It's appointment only. We did the drive-up flu clinics this month for October, which basically what we wanted to do was to go ahead and get that as a drive-up flu clinic to get us prepared for the COVID vaccine. So we're actually looking more at larger places than the fire stations. So we've reached out to the airport and different, some really big places where they can go ahead. I'm more concerned about people passing out than anything else. So I want them to be viewed before they leave the facility and get in an accident or anything. This is a new vaccine. It's not like a flu vaccine where a lot of the elderly come through and they're okay. They can leave within 5 seconds or 5 minutes. They're good. This is something new. I don't know what kind of risks we have, and we'll go through that as we figure out which one we're going to be getting. We've completed all of the paperwork that we've had to submit through ODH. We had to do steps. That is completed. So we're on the list to get the vaccine. However, saying that, it will be by area first. So it's probably going to be our people that are our emergency preparedness people. So where the hospitals are going to get it, and then it's going to be step by step of who gets it, and we will be instructed through ODH. ODH will be giving us supplies as far as syringes, alcohol pads, and cotton balls and Band-Aids. Other than that, we have to order everything else. So we're getting ready for that. We've had several meetings already with our health department, figuring out how we're going to do this, because it's going to be on a much, much larger scale.
Rose, can I interrupt?
Absolutely.
Is there a mechanism for adverse reaction reporting?
Oh yeah, we have that. It's actually, we have it online, and we also have paper forms. So we'll have that available as well, which is going to be really important because they're not really, I forget how many I saw that they were actually testing with the new vaccine. So it depends on what vaccine comes. So we're not going to know. So if we get the one vaccine that has to be ultra cold, we have a limited time that we can use that vaccine without keeping it -70.
Right.
I don't have any mechanism to keep anything at that level, that low. I know the hospital does, but I don't know what capacity. So saying this, when we actually had to sign up with ODH, we literally had to measure our refrigerator and freezer to figure out how many vials we can get in each.
Yeah. So I don't know if it's helpful to you, and I don't know that ODH would approve it, but I have a -80 that can be adjusted to -70. And it's the size of a dorm refrigerator, but it is a -80 freezer. If that's helpful to you, I have no problem with you borrowing it.
Oh, great. All right. Thanks. I will find that out. So I really hope that I don't get that. I'd rather just have regular vaccine where I know I can use it, because then I have to worry about dry ice and stuff like that. So
I think if the news media is correct, it's the Pfizer vaccine that'll be available.
that's what I'm thinking.
And that's the -80, that -71, I believe.
Yeah. So we're not 100% sure. We're waiting to see. But we're getting prepared for it just in case. So we've actually reached out to a lot of the ice companies that do the dry ice,
Okay.
so that we have that online too. But thanks, Chris. I'm going to write that down so I don't forget it.
And is there anything that you need Kent City Health Department to do for vaccine delivery?
Right now, no. I think it'll just come to our health department. We've actually ordered another refrigerator. So once that comes in, it should be coming in with the next 2 weeks. So we should be good, because then at least I'll have a totally empty refrigerator. They have to be certain monitored, because we have to make sure that they follow all of our regular vaccine guidelines, and the state will come out and actually view ours. The monitors, the thermometers that we use actually plug into the computer, where the state can see making sure our refrigerators are at the temperature they need to be. So
Mine should have a monitor that plugs into our security system to monitor the temperature.
okay, yeah. So thanks for that. So that's what we're waiting for, but we're going to be actually doing a mock drill just in case with our cones and stuff like that we have going on. But we've done the same thing when we've had our flu clinics in the fire departments. The fire departments are very happy. They are very excited and hope that we can do that. They're there to help us. we have the policies in place for the EMS to go ahead and assist us. So that is really good because I will not have, and learning from H1N1, I will not go anywhere without, I have an emergency bag, I have EMS on standby, and I have an ambulance on standby and a police department. So those are all worked out, and we're going with that because of the fact I've had with the H1N1, the experience of multiple people having seizures.
Yeah.
And yeah, one was transported to Akron Children's. So I want to make sure that that is all available and we're all good. So, and I won't do anything without that because I've learned from mistakes. So, which is a good thing. So we're still trying. So we got the immunization still going while we're still going to Kent Clinic, which is working out good. We're still making the appointments. We want everybody to be safe. We're still doing the children with medical handicaps, only on a smaller scale because we've been getting really hit hard with our COVID. But we're getting everything done. ODH has been working with us very diligently in making sure everything is going and just increasing people as we go. So, which has really helped. We have Mamie Brower, who is a nurse actually from Canada. So she actually did COVID-19 for like 3 months, and they were on 12-hour shifts 5 days a week. And it was continuous. So they usually get, she said, on the average about 200 in some cases a day. So yeah, so she was come with experience. We didn't even have to train her. She was ready to go. So, but she was actually going to do our child fatality, but we had a nurse leave. So she went into the immunization. So child fatality is going to, we're trying to hire a nurse during this pandemic. It's not easy, but we're trying, but we're going to try and do child fatality. It will be a virtual meeting. However, we're trying to get the information from the hospitals. Communicable disease, we are trying to work with Penny. And like I said, this is on a very little caseload. Trying to get more information from our communicable diseases. They're into the system, but they don't put information. I don't get treatments. I don't get, I don't get their sex. There's a lot of things that we're missing. So we actually worked with the STDs and we've actually actually Mamie made it for us. It's a spread, not just spreadsheet, just information. So we don't want to ask about their contacts right now, because then we would have to follow up with them. So we're asking if they're male or female, black and white, if they got treated, what they got treated with, and other demographic information. So we can put it in to ODRS, and we can pull more information out that we need, where we can see clusters that are going. Because right now, if we don't have that information, we can't see where there are problems are. So we're working that out.
Rose,
Yeah.
Angela, wouldn't the hospital EMR be able to dump that information right into Rose's system?
I know they have to dump positive labs, but I don't know if they don't dump anything else.
Is that something we can ask the laboratories and the hospitals to report to you?
It would be very nice, Chris, but we can't even get them to put COVID-19 in.
No.
So we're having issues with that, and that's an order from the from Ohio Department of Health that they have to do it. If they're testing, they have to put them in ODRS, and we don't even get that. If we get them in there, we get a name and we get an address, no phone number, no occupation, no male, no female, nothing. So that's our issues. So if we can't get it for one, we know we're not going to get it. It would be nice. And Angela, I don't know, can you guide us on that?
On getting information out of an EMR into a different.
Yeah.
Good luck.
Yes.
You know,
we had this when you had your practice.
Right. We went
Yes.
through it with immunizations. Yeah.
Yeah.
I mean, you have to have the will of the IT people on both sides.
Right.
Make it happen. So not that it couldn't happen, but yeah.
Okay.
Yes. So yeah, we did make that little form, and we're going to continue. If we need more information, we'll just put more information on there. So far, it's been working out good. The physicians are filling it out. It's very easy, and they're faxing it right back to us, which is perfect. So that is really good. We're really happy about that. So as you can see, it has our immunization, our flu clinics on the bottom of the one page, and I didn't even number my pages. So, and then we have the EPI's report. So with communicable disease, as you guys can see, she's extremely busy trying to get all of our contact tracers up, giving them the information. If we need to adjust something, it's we're constantly adjusting, which I'm sure that you guys are too. It is just, we're learning as we go. And hopefully by the time this is done, we're going to be proficient. But unfortunately, we're keep on going, you know, and that's all we can do. So, and then Penny has her map. And Chris, I did ask her about the zip code. And there's not that many people using that zip code for KSU. It's always the others. And the other thing we have too is when they're in an apartment. So they just put their address without their apartment number. So when we go to send them a letter, it's being kicked back because of the fact there's no apartment number. So, and those are for our isolation and our contacts. People don't, I can't believe of how many mail I get kicked back because no such number. Wow. Or the person doesn't live there, or, you know, it's just crazy. But so our reports are the communicable disease is on there. And do you guys have any questions?
Anything?
I have a question.
Sure.
Oops, sorry. I was just curious, could you talk a little bit about the kind of testing options that are available right now? I know I feel like I fielded a lot of questions regarding, you know, rapid testing and, you know, elsewhere. I wasn't sure, you know, if there are specific facilities that are actually doing rapid testing for the public, or if that's just, you know, some of the nursing home populations. I'm just kind of curious what all is out there right now.
Okay, so there are the rapid tests, and Joan, jump in too. There are the rapid tests. So if that becomes positive, then we want somebody to get a PCR. So that's
okay.
The nasal pharyngeal. All right, I know there is another test that the nursing homes use that are just nasal, and they put it into a system and they know right then and there what it is. Again, if that's positive, they ask for a nasal pharyngeal just to make sure that's positive, because there's a lot of false positives on that. There is UH Portage is actually conducting an experiment with some of their emergency responders as far as getting the antibodies. So they're working on that. And we've had some issues where some of the first responders live in different counties, and they're making them like be quarantined and stuff like that, when these are just antibodies. We don't do anything with the antibodies because we're not 100% sure what's going on. There is actually another, in Aurora Farms, there is another company that is going to be opening up there just to do the antibody testing. So until we know furthermore what the antibodies are showing us and what not showing us, and we get further direction, right now we're just trying to do our PCRs. And we also get probables. So if a physician, if you would say it was for you, you come in there and you have a fever and you have no the loss of smell and taste, and you are having very severe fatigueness and different things, he's not going to run a test on you. He's not going to waste your money. He's going to say you're probable because you meet the criteria for that. However, we get probables that say they have a runny nose and a headache. That's not telling me anything about the case. So we have to call the case and confirm it. So going back to what you want, there's a lot of tests out there, but a lot of the nasal pharyngeal right now is the best test that we have to give us a more of an accurate picture.
So will that probable, I mean, as with flu season approaching as well, all of these symptoms being so concerning for multiple things, would that change how probable cases are viewed then? Would they start testing more for those?
They do. I've noticed they do test more for that because of the fact they're not sure. But we ask the individuals when we actually call them, like, is this normal for the time of year? Like for me, I mean, I've got the headache, I got the runny nose. It's normal for me. The leaves are coming off the trees. My issues are when they come off the tree and when they go on the tree. I'm not going to go get tested because I know that's my normal. So, so saying that, there are people that get tested, it does come back negative, but when they go to work, a lot of their businesses are freaking out. So, and then we usually talk to them and say, okay, but she knows the guidelines. So what we have to watch are the people that are running temps, then they take Tylenol, and then they have a temp the next day, they take Tylenol. Then they don't have a temp, but then, for 24 hours, and then all of a sudden they start running a temp again. And they're trying to, I don't know if they're trying to get in their mind that they don't have it or they don't want to go get tested. So we run into those too. So there is just so much that we run into with these tests. And trust me, every day we sit there, we go, okay, is this a good one? Is this a bad one? Because of the fact there are so many people testing and it's hard to get that information.
And Rose, correct me if I'm wrong, but as far as Louise's question about the probables, are we still following the ODH probable definition, which means you have to have those very typical
main points.
Also, you have to have an epi-link, a contact of a confirmed case.
Right.
That's the only scenario where we would call somebody a probable case even without a test. Is that still?
Yes,
right?
It is. I just got one today from Kent State University. She met all the criteria and her roommate was positive.
So
there you go. So I don't need to test her to get positive because her roommate was positive.
Okay.
And then, so absolutely. We definitely follow all those.
Thank you.
You should also note that there's nothing else that it likely could be. I know UH will, on their respiratory panel, they should include not only RSV and influenza and COVID, but some other likely respiratory illnesses that if they could test you, they'll test you for all 4 or 5 of those instead of just one. And that I think will help make people fit into a bucket better, so that if they do have that contact with a known case and maybe they want to call them probable, they can at least roll out. But say the test comes back negative or something.
We should start seeing that really soon. We started getting some of the lab tests on the flu, but we haven't really seen a whole lot of cases here yet. But it won't take long, especially with the weather changing. So absolutely, Joan.
But in terms of testing, mostly we see PCR like at Access Point, CVS, at UH Portage, whether it's the fever clinic or urgent care. I think there's also a CVS in Mogador. At Kent State, are doing some rapid antigen testing, but they're doing that mostly for the sports teams. And when those come back positive, because they're testing asymptomatic individuals where there is the sensitivity and specificity for asymptomatics with that is not as high. It's really very high if you're symptomatic. So when an asymptomatic tests positive with a rapid antigen, then they will follow up with a PCR. And so that's mostly where I see rapid antigen is at the university level with athletics.
Yeah, we don't see a whole lot with that right now, but I imagine as it comes up, we probably will, because I know there's a lot of companies out there pushing their rapid tests. I do know nursing homes do use them because right now in our community, they are testing every week. If we start seeing an outbreak in the nursing homes, it will go to twice a week. So so hopefully we're pretty good with our nursing homes.
Right. That's a point of care testing that they're using. So, I mean, probably Louise, you're used to hearing that from the hospital setting, like a blood glucose test.
It's one of my favorite phrases.
Right? So using at the nursing home level, so that it's a waived test. Yeah.
Thank you.
All right. Questions for Rose on the communicable disease report and the FIP report? As usual, Rose, thank you so much. We appreciate you attending the meetings.
Thank you, guys. Have a good day. Everybody stay safe. Have a nice holiday and be safe.
You as well. Take
You
care.
too.
All right, bye-bye.
All right, we're going to go back to the top of the agenda there. We're going to come back to action items so we can move things along. That's agenda item number 6, and then we'll come back to reports after that. Okay? All right, so is there a motion to approve expenditures and encumbrances for October?
So
I'll
moved.
motion to approve the
I'll second.
expenditures.
Hey, Jack got in before you there.
Okay.
Michelle,
Sorry, that's okay. I was muted, so
will you second?
I'll second.
All right. So there's been a motion and a second. Any discussion on the expenditures and encumbrances for October? Hearing none, all in favor of approval, aye.
Aye.
Opposed? The motion carries. And before we get into the resolution for food services, Justin, did you want to speak to that?
Yes, thank you. I guess I've created a little bit of a PowerPoint for everybody to go over what a cost analysis is and kind of address some of the major points that we need to look into when it comes to approving our fees for like long-term planning for our budget when it comes to the food program. I'm going to try to do this. Try to share my screen. It says host participating. So Mike, I'm unable to share my screen right now.
Mike, as the host, do you have to? Oh, okay. He just transferred it to you, Justin.
Okay. Can you see it?
Yep.
Okay. So as I talked to some of the other directors around the northeastern area, they told me that this is something that they would do whenever time they would be contested with their fees. And that's just kind of trying to get an idea of what we do when it comes to determining what our fees are. And that's pretty much discussing what a cost analysis is. So the overview for this quick presentation is only 16 slides, so we'll get through as quickly as I can. Just talking about what our proposed fees are. We're going to discuss what a cost analysis is, and open it up for questions and answers and conclude. So the OAC 3701-21-02 talks about what the cost analysis is and how to calculate it. We have to do this every year. It's required by law. And we have to use a previous fiscal year. And it's not the licensing year, it's the fiscal year. So it's from January 1st through December 31st. So each year is going to be different depending on when licenses get renewed, when licenses are issued. So if we issue a license, like a 15-month license, it's going to show up on the previous fiscal year and it will not be on the current fiscal year. We have to do this for risk level 1, 2, 3s, 4s, for both food service and retail. Mobile, retail mobile, and food service mobiles, temporaries, and vending machines. Once we determine the fees, we have our public hearing, then you approve them, and then there is I have to mail out a notice to all of the operators regarding the public hearing 20 days in advance. So they have a legal right to know when the fees are going to be increased and have a right to comment. Sorry for the wordiness of the slide, but I just want to let everyone know that this is how we calculate it. We use 1 through 9. We have to keep track of this throughout the year. Some of our programs allow us to do this quite easily, and then some other items allow us to keep track of the payment that we pay our sanitarians. Fringe benefits seems to be something that has been left off of previous cost analysis. And also the support costs I've noticed since taking over the cost analysis that we're really missing out on. Secretarial staffs, supervisory staff, utilities, supplies, equipment, insurance, and training has never really been included in any of the cost analysis for the Kent City. And that's pretty important to include because those all can be met with a 30% through your cost fees. So to get into the analysis, we are only using about 23% of our support costs. We aren't allowed to exceed 30, but the state of Ohio would like us to see that number to be at 30%. So out of all the risk licenses that we issued in 2019, we had 197 licensed issues, and that includes vending machines. That includes well, actually, this number only includes the risk facilities. So that would be your 1, 2, 3s, and 4s. We have to keep track of our average sanitarian hours that we spend in each facility. And in 2019, our sanitarian spent 8 hours, and we were maximum allowed 9 hours, which is actually pretty good. Previous years, we've had 6, we've had 7. So this is the most I've seen in our cost analysis. So that means our sanitarians are out in the field completing standard inspections, which is the most important thing of our food program. Wanted to let you know that we collected, $100,000 in license fees. Our total program costs were, $133,000. So based on our risk level facilities, that's 1, 2, 3, 4, we're at a $30,000 deficit. And that's about a negative $164 per license that we issue. So that's a pretty big deficit. And when I submitted the cost analysis to ODH, they wanted me to really look at the deficit because that's a pretty significant deficit compared to how many licenses we issued. So moving on to the mobile facilities, our average sanitarian hours spent on our mobile license is 6.6 hours. We collect about $3,000, but we spend about $7,000 in that program. So that's a pretty significant deficit. All right, so that's $381. So we're losing a lot of money every time we issue a mobile license. And then the vending facilities is something that we just won't ever meet this number because of the CPI, which reduces the amount that we can increase that license. So we're spending about an hour in each one of our vending locations and only receiving $534, but we spend $2,100. So that deficit will always be there until we can match that cost. Temporary facilities, and this is something I'm sure you've heard about. We do not bring enough money in to support the temporary program. Our average hours, we spend about 2.6 hours per each license that we issue. And as you can see, there's a significant deficit there. So overall, our total revenue is $107,000, and our total cost to run our food program based on our analysis, including most of our support costs, makes us have a deficit of about $43,000, which is a little concerning when it comes to trying to increase our fees. And as you can see over the years, I'm sure you've seen this in the last board meeting, we try to throw this together to show you what we did last year with the cost analysis and our increases. So it wasn't a significant increase last year. The most we did was 92 for the large facilities. Moving on to this current year and our proposed fees, we're asking for some pretty significant increases in our class 4s, in our larger facilities. And I wanted to add a column here to show any of the operators that are listening or would like to know the cost per day to operate based on the license fee. As you can see, it increases with risk category, which means we would spend more time in those locations. And then the recreational program, we haven't received any comments about our pool program and our fee increases. And you've seen this is nothing new. We haven't increased our pool fees in a few years now. And then the body art fees, we are asking to do a significant increase for this, and that's just trying to meet what the analysis was determined to be about $902. So we did get a comment for our body art fees. Wendy is a great operator. She's always been very easy to work with, and she makes some good points when she talks about trying to license per the artist. Unfortunately, our current rules do not allow us to license per artist. We are able to license based on what the rules and the laws allow us to. So I wanted to provide you with a quick overview of what the body art rules require for fees, and they give us 4 options to license for category for licensing for body art. That's just tattoos only, body piercing only, and combined body art services, meaning that they will provide tattooing and piercing. And then a time limited event, which is like a temporary event for tattoo establishments, like an outdoor tattoo festival, or piercing festival. So those are the categories we're limited to. We could determine to change that fee to be less for a tattooing location only or body piercing location only. But through my experience inspecting the body art establishments is they all take the same amount of time because you have to look at everything anyways. You have to look at all the logs and the mill certificates, and you have to speak to each body artist. So her point that she was trying to make is that she's a single operator, and she doesn't feel that it's fair that she has to pay the same amount as a large facility that has 5 to 15 to 20 body artists working in the facility, which that's a very valid point, and I appreciate her concerns. So that's
the largest tattoo parlor with the most artists, Justin?
I believe it's Warhorse Inc. now. Defines Tattoos has about 4 locations that they could put in an artist. I think they've increased it to 6, but they had to reduce that. They just increased it to 6 last year, but with COVID, they reduced it down to 3 to provide adequate distancing between the.
So the establishments with the most number is one establishment with 3 artists.
So that would be them. Now, Warhorse Inc., they have anywhere between 3 people working in there. Pre-COVID, I've seen up to 10 to at least sometimes 15 people waiting, if you include the waiting room. But they have more than that on staff, artist-wise. So they have a lot more people. And I know the state has looked into the rules to change them because they would like us to license and register each artist for $250. They would register with ODH. And that's something that is in the new rule revision, but that doesn't change. That money would be collected and sent to ODH. So it would go to the State Department versus the fees for the facility. So I wanted to kind of create a comparison on our fees, our proposed fees with the state fees included compared to some other local districts in our area. And our neighbor in Portage County, it's pretty important to look at those numbers compared to ours. And these are last year's fees. So we're trying to catch up right now. And these are their fees last year. So we're still underneath, below what they are requesting. And same with now Summit, they're much lower than us, and there's reasons why. It depends on who's completing the program. If you're a first-year sanitarian and you're an SIT, the program could be much less to run because of the pay. Here in Kent, we do have some sanitarians that are experienced. So they do get paid more than a new sanitarian would be. The plan review cost, I would admit, is high. But when we did the methodology on this, we break even with that cost. And then some counties do a 30% of the license fee. That's an option that we can do. Summit County charges 100 less than us. I don't believe that's going to change this year. And some locations do provide different plan reviews based on the risk level. I don't think size matters when it comes to plan reviews. A plan review at an Acme or Giant Eagle, to be honest, I've done a few of them. They're actually quite easy because they've done it so many times. Whereas a level one a level one independent operation could take a lot longer to work with due to the fact that they've never opened up a facility before. Some locations charge a flat fee, and then they would charge a lower fee for alterations. So like a half plan review for maybe they wanted to add a bar. And then you see Columbus has this 210, but they also charge more depending on the hour. The other option we have is to charge by the hour as well, which could be cumbersome because we have to track the fees and then try to get that fee from them before we issue the license. Looking at the pool fees, I think we're pretty comparable to the surrounding areas. Maybe that's why we haven't heard anything from them. You know, 505 compared to 550 in Cuyahoga. And then the body art fees, I think we're kind of getting pretty close to where we need to be at. And then again, the plan review fee, we were requesting to increase that $100, and that's pretty comparable to the neighboring communities that do charge a plan review fee for a new operation.
Just to be clear, this is per year, correct?
Per year, yeah.
So $100 per year.
No, that plan review fee is a single fee for a new establishment when they're trying to.
Single fee, single time.
Single fee, yep. Annual, it's just a one-time fee on non-refundable.
Okay.
So as you can see, our temporary fees are much higher. Our temporary food service fees, we're requesting them to be increased to 140, and I mean, if you can see Portage is 75, Summit's 100, so they're significantly lower, and that has to do something with our contracts with our employees with the ASME contract.
Justin, these class sizes these are state mandated. This isn't something that would be city, be able to be adjusted.
Yeah, it's all controlled by the ORC and the OAC, and as you can see, it's 1 through 4, and it's based on their risk to public health, based on the activities that they do inside the establishment. For example, CVS would be a class 1. It's fairly simple. The only risk that they have is employee health. And maybe if a cooler goes down, the milk and the eggs and the bacon may spoil. Whereas you get into a location that may do chili, the chili would be cooked. There's raw meat, they're cooked, and they could possibly be cooled and then reheated. So every time you change that food to the temperature danger zone, it increases the chance of bacterial growth, which increases their risk to public health. If I serve sushi, that would increase just the fact that they're serving raw fish would be an increase to public health risk. And when we determine what the risk category is through plan review, our cost analysis will determine how long we should be spending in those facilities. So the state would like us in there 9 hours. So and we were at 8. So and I wanted to share another. Let's see here. Did I put it in here? Yeah. So our max. So in this slide, this column here was telling us what, once I put all the information into the forms, it spits out a number. And it tells us what our maximum allowed or maximum allowed cost, and that's without the state fee now. So this does not include our state administrative fees that we'll have to send down each quarter. So, and based on our analysis, we could increase our fees based on the Ohio Revised Code or the Administrative Code to 301, and we're just requesting it to be to $252, and then our class twos would be 292 when we could go all the way up to 340. And so
I'm sorry to interrupt, Justin. Is the state adjusting any of the costs due to COVID? Like I know like our city and the vendors would like us to adjust our costs according to COVID. Is the state making any of those movements as well?
No, not at this time. I did reach out to the directors forum and got a lot of feedback from Stark County and Cuyahoga. They both sit on RISAC, and that's the Retail Food Advisory Board. And there is some talk of some temporary freezing of fees, which could benefit or could hurt either side, either the operator or the licensor. What we were recommended to look at our fees and look at our deficit and see if we could survive with that deficit. So if we lock our fees in with our current fees, we're going to be okay. If we increase our fees, we're going to be okay. We're still at a deficit even if we increase. So we're playing catch up. We're going to be playing catch up for a while. And
what's the projected deficit with the fee increase?
I do not know that. I was just thinking that would be good to have that number. I could look into and try to get that number to you all. One of the things that they were talking about with the state was they don't know how we're going to be able to get an accurate cost analysis based on the 2020 numbers, considering majority of the food programs in the state of Ohio have been put on hold to help out with COVID-19 in the response, either with enforcement action or a lot of the food sanitarians are doing contact tracing right now. And you can't run a cost analysis accurately if you don't have an accurate data to enter into that. So they're concerned that if based on our time that we've spent now, we would possibly increase our fees this year and then dramatically drop them next year based on our analysis for 2020. And that hasn't been determined by the state if they're going to do that yet or not. It seems like industry and local health districts are all on board to do a freeze. ODH may not. They haven't determined that that is the best option for everyone yet. I'll be honest, I submitted the cost analysis for the food program to ODH, and they told me to take a harder look at it because they thought our fees were too low. So I'll put it clear for you here. Either you have your operators pay for the license fees to cover the cost of the program, or the taxpayers pay to cover the cost of the program. So either way, the program will have the money they need. We'll have the money we need based on the taxpayer funding, which isn't necessarily how the program should be operating.
Let me ask it a different way, Justin. Are we violating any state law by not increasing the fees?
No, you don't have to increase your fees. So,
but you said
again,
ODH
it's just
wants you to look harder at it because we're in a deficit. Yeah,
when they see the $40,000 deficit, you're not break any rules. You can operate a deficit, but they would like the program to be even.
And they're still wanting their cut no matter what.
They still get their cut no matter what. So if we increase the fee to $1,000, they still collect $28 for every license that we issue, and then $6 for every vending machine,
Right.
and $80 for every pool, and $55 for every additional pool after that. So they still get their cut, and it's important for them to have that money so that they can do what they do at the state level.
But they're not the ones sending a sanitarian in to do the inspections or the
No,
review
sir.
plan.
Nope. So, we're kind of stuck in a tough situation with COVID right now. And anyone that's listening, I hear your pain, and I understand what they're going through. To some level, I'm not, the sanitarians here aren't the ones seeing the money in and the money, the money coming in, and I can only imagine what these small business owners are going through, and it scares me to death. So asking for a fee increase, some of the comments that have come in, we're not trying to kick anybody while they're down. It's just we've been playing catch up for the last 3 years.
So the other way of looking at it, and again, I completely sympathize with the business owners, but the other way to look at it is that they have not been charged what they were supposed to have been charged over the last 3 years.
I would second that, yes. Or over the last 10 years. The original cost analysis back in 2011 was significantly missing the mark when it comes to covering the cost for the program.
Yeah, it was undervalued.
Yeah, and that we've been playing catch up since. And it's a tough situation, especially with COVID. And in 2021, we may not be in a much better situation. So,
right. Are there other questions for Justin?
And just a couple. I've reached out to some of the, Stark County. They're talking about increasing their fees just slightly, 1 to 3%.
Do something like this.
Summit is locked in. They're not increasing theirs. Medina is going to move ahead and increase their fees. Wayne County is not increasing their fees. They're going to lock in. And then Cuyahoga County is planning to increase theirs 6 to 10%. So there's other agencies out there that are going to increase their fees this year.
There's a little bit of a scupper that you kind of drain.
So we're getting some feedback from somebody up. Okay, good, thanks.
And that's all I have for my presentation for you.
All right. We really appreciate you putting all this together. It's very helpful in us analyzing the data and looking for the methods that we need to process the resolution.
Sure. I just wanted to give you guys give you all the facts that you need to know so you can make your decision.
Right. Thank you.
Could I ask how many businesses, like total, do we, from 2019, how many did we have licenses for? And then a 2020, how many, like, did it go down? Did it go up? What is our amount?
I don't know the exact number off the top of my head, but I do believe we are down when it comes to license fees received. We have not issued as many licenses as we did last year. And I will say KSU has shut down a lot of their food services. So, and they're actually providing me with documentation that they're shutting down at least probably 15 more. They're going to be closing all their vending machine locations as well. And so it's, we're going to lose probably about 25 retail and food service establishments, class 3s and 4s next year. On campus alone. So that's just what we've been told. I have the documentation to not send them renewals because they're not going to renew them next year. But I can get you an exact number. I just have to run a report and see when the permits were issued. And
Are these fees always paid at once, or are people able to spread it out, or would that be something that would be a little too complicated or add
it would be
more
nice.
to
It
it?
would be nice to do. No, they're all due. We'll send out our renewals probably January 1st, and they're due by March 1st. It's an annual fee. And
When
then
was the last time the costs were increased then?
last year?
Last year?
Yeah, for food services, we increased them slightly. And last year, when I did the analysis, I tried to limit how much anticipated cost I was including because we didn't know what was happening with the move, and we didn't really know what those total fees were going to be. So I tried to limit it, but we could have significantly increased our fees to what we have now. What we're requesting this year, we could have done last year without a problem. So, because the analysis is pretty much almost the same.
The deficit was similar as well.
Yes, it actually probably was more last year. There is something to consider too. Every time an employee gets a pay raise and is working in the program, those fees will show that. So at this point, all the sanitarians working in the food program are at their max ASME step increase. So we shouldn't see significant increases when it comes to employee costs and fringe benefits from here on out if our sanitarians all stay consistent.
So the other way I hear the answer to Louise's question is that if you're going to have significantly fewer establishments to inspect, then your inspection hours are going to go way down.
Not necessarily, because that's an average based on each establishment we go into. So one less facility means one less inspection. Now our hours spent in the program will go down, and our hours spent in the environmental program. So the analysis requires me to find out how many hours everybody worked for that year, minus what they worked outside of environmental health, and then subtract, and then try to split up what they worked in the food program alone.
Right, but if you're doing
so that hour,
then the total number goes down, right?
The total number of hours spent will go down, but the total number of hours spent in our facilities should stay consistent.
Correct.
Because it's based on each time we go in. So our total, I don't think having less establishments is going to adjust the cost analysis for what we can charge per facility. It's just we won't have as much revenue coming in because the license fees won't be able to be obtained.
Justin, is there any way we can possibly delay this 6 months? I'm a landlord for a restaurant that is struggling to pay their rent. I worry about that. City Council worked very hard to redevelop downtown, and I don't want to see places close.
I don't either. That would be the last thing I want to see any of our food facilities to close. We can postpone it till next year and see where everyone's at then, and just lock into our fees. But like I said, we could be locked into these fees until 2024. That was what was presented at RISAC, which was what seemed to work with everybody's opinion on the situation when it comes to our cost analysis for next year. That's what the concern is next year's cost analysis. Is that those fees are going to be all over the board wherever you're at. So, like for example, this year I have done a handful of food inspections, whereas last year at this time I probably had at least 50, 80 in. The temporaries, usually have 30 temporaries by this time, and we have like 11. So a lot of mobiles did not renew. We had pools that did not renew. We actually refunded a pool fee. So our money is not what it was last year. When you look at the statistical report, it's going to be off because we're not getting as many renewals. So that's why the RISAC is trying to push that freeze, so that when we come out of this recession, and we could be still above water. But that does not help our operators. That's the problem, is that's helping us. It's not helping the operators.
I think something that I've certainly thought about when reviewing this issue is, you know, kind of like how you mentioned, there were so many less facilities this year for inspection. You know, if these businesses are so poorly affected by this right now, then, you know, who's going to be open next year? You know, what kind of effect is that going to have in the long run, I guess? You know, I know several businesses have already closed down because of that, but it's just something that I was thinking about, you know, and potentially there will be more coming. So
yeah, there will be more coming. I mean, from what I've heard, it doesn't look good on the horizon right now if we continue with the restrictions that we have. In our town, it's important to get the money when it's available. And that's when the students are in town, and that's when the weather is nice. And that is probably going to be gone tomorrow. So with the weather, at least. So it's going to be tough. It's going to be tough for them. And I talk to them, and it's not a good situation at all. But COVID-19 is also not a good situation. So it's
Okay, and anything else for Justin? Justin, thanks again for coming and delivering that report. It was very helpful.
Thank you.
Joan, I'd be very interested in any comments you might have on this, since you kind of oversee all of these.
Sure. And, you know, certainly on a daily basis, we hear about how businesses downtown are struggling. And if we have more and more business closures, then, you know, we worry about our well-being from that aspect as well. So, you know, all along, I think I have always said we want a safe and healthy community so that they can have a safe and healthy downtown. Like, those two things go hand in hand. We have to have a healthy population to have a healthy economy. I don't know if some of the FSOs don't realize that we're not just all of a sudden throwing these fees increases out there, but we're asked to do them on an annual basis. And this is just the timeline to do them. This year we made a point of having 3 readings that, you know, Justin planned and budgeted his time so that he could have this all done, so we wouldn't have to do it in one reading and as an emergency, that we would have the time. He sent the information out to the operators as well, but we didn't just until I think the past week or 10 days started to hear, even though he had sent that information out well before the last meeting. So yeah, I mean, I see both sides of the picture. I really do. I know we would struggle without it. They struggle with it. You know, I know that City Council had a hard time passing a water utility fee increase because of the same concerns. But I don't know if Jack wants to weigh in on that, but I believe that they did pass that fee increase because, again, the city needed that for its budget because the water program was running at a deficit and has a projected deficit. We don't want to be in that same boat where we're a continual drain on the city. We want to make sure that we can create our own revenue and sustain ourselves. But again, we need operators at the same time so that we have places to inspect. Yeah.
So Joan, I know we don't have the absolute numbers, but guesstimating with the number of businesses that are not functional, that have not been able to stay open, what is that impact going to be on the deficit?
I can imagine that would only increase it.
Okay. And so,
You know, council worked on the water, the raise in the water rate. they wanted 9% and we dropped it down to 3% because we understand that people are struggling. And again, that's why I said, can we postpone this 6 months? Because I really worry about the viability of downtown. I mean, it's very, very concerning. And, you know, I understand we also have to function, but again, I don't think, you know, putting ourselves in the listen, I'm very fortunate. I've been making it through COVID without any real problems, but I've talked to people who can't even, you know, can't pay their rent, can't pay bills. The city has actually gone to allowing people to make their water payments on time, you know, basically month by a piece at a time, because they can't afford to pay their water bills. So I'm worried. I have to tell you, as a councilman, I'm worried. So,
I mean, and we can certainly postpone. We don't like Justin said, we don't have to have a fee increase, but we just have to realize that there's ramifications to that course of action as well. So, I mean, there's consequences either way. I know many people have said it would be a good faith effort on our part if we would hold the fees in place, but I don't know that they realize that there could be up to a 3-year freeze. And that would mean in year 4, when we could finally, you know, if they do put that freeze into effect, we would have a huge increase just at the same time that businesses are maybe starting to get back on their feet. So we're looking at then long-term projected deficits for this program. And we need, again, we need the operators to be inspected so that we know that it's safe for people to come and eat there, because we don't want there to be a foodborne outbreak. I think nothing would damage the city more than to have, you know, some issues such as that. So.
In the cost analysis, Joan, is there a safe number for us that we could back down to?
You know, I think since Justin did these numbers, I would leave that up to him. But I mean, certainly we didn't increase the maximum. Justin, do you know the percentage that we did raise out of the allowable that we could have? Like, was this a 70% fee increase out of what the 100% could have been?
There wasn't a specific percentage increase, but I was looking at the fees, I was trying to keep it a ballpark number.
Yeah.
So that we weren't dealing with half costs and cents.
Right. We try to
round it to an even number.
23 cents. We try to keep it rounded. Yeah.
Yeah.
But I mean,
and again, just trying to keep it consistent based on the risk category. Again, it depends on how we do our inspections and how much time we spend inside the facilities that we'll send out that fee. So.
But I mean, certainly there could be a motion to reduce the fee by a certain amount, and then we could bring it back at the December meeting. Now, at that meeting, it would have to be, if it was going to be passed, it would have to be passed under emergency measure, because it would be a one-time read only.
Right.
Yes. Yeah, that could work too. If we wanted to reduce the fees, you could reduce the fees. It just depends on how much of a deficit you want the program to operate at.
Well, that's the question I was trying to get at earlier, Justin. If we don't do anything to the fees and you're not inspecting as much, your average time doesn't change, but your total time changes. So how does that impact the deficit is what I was trying to get at.
Yeah, it's a very good point. I'll have to do some numbers, but I won't know what our 2021 fees, our 2022 fees will be until we complete the year 2021. So we're kind of, and then that's based off of, we have to complete 2020 first. So once we get to January 1st of 2021, I'll be able to tell you, I could run this analysis at that point and we have a better idea.
Oh.
And if you like, I can put together another table that shows you the percentage increases for each risk category.
I think we need to make a decision tonight based on the data you've already given us. So
I guess like someone had mentioned, there's differences in when Kent State is in session, when Kent State isn't in session. So maybe that month, like maybe we shouldn't have a one fee for the whole year. Maybe it should be a biannual or a quarterly fee so that the businesses can incorporate the ebb and flow of when the students are here, when they're not here. Maybe that works out better for them.
Like a prorated license fee?
I mean, not prorated, but just quarterly or whatnot, just so that they don't have to, because then if they do end up closing, say they close in July, they've paid for the whole year. That's, I mean, that's so horrible.
It's a good idea, but the rule still requires to inspect it 2 times a year. Even a seasonal operation like a concession stand at a baseball field, if they're selling hot dogs, they're risk category 3, they could be labeled as a seasonal operation. They still have to be inspected twice a year, and they still have to follow the food code just like a McDonald's or Burger King would. So, and they still have to pay the same amount. And personally, I have an issue with that. Professionally, I read the law and the rules, and it says it right in there that it's the same amount. Now, there is an option that you could provide a non-commercial license fee at a reduced rate for schools and you know, not non-for-profit operations.
Joan, what is your feeling if we say some magic number like 50% less than what we were going to charge for 21?
Yeah, I think, you know, that maybe that shows that there's some willingness to compromise. I mean, yeah, I'm torn between just saying, look, okay, we'll run at the deficit, but just realize then that means that we're going to draw more from the city at a time when the city's not going to maybe have it in the budget in the next 4 years either. Right. So, yeah.
But to your point earlier, it'll also mean that we'll have to catch up in year 3 or 4.
Yeah. So, and Justin, I don't know, in speaking with other food operators, if they say, like, if you just didn't charge as much, I mean, because really what we had complaints were, like, out of 197, we had complaints from 4. We didn't have, I mean, maybe it was a couple on the side that were verbally, hey, it's too bad you had to do that. Maybe more were thinking it and more didn't step forward, but only 4, really 3 or 4 came forward to say, please don't do this.
Yeah, but out in the field, I've heard it from a few people. You know, the owner of the pub, she's mentioned that the fees are kind of hard for her because she's on a reduced operation and she's a bar and they make their money after 10 o'clock and they can't operate after 10 o'clock. The ice cream, Stotter's ice cream, Lisa, she had mentioned that the mobile fee is quite high, considering how many ice cream cones she'd have to sell to make that fee back, especially when there's no events available for her mobile truck to go to. So it makes it very hard for her to make that money back. And Henry Wainers, she doesn't want any fee increase. Every year that we've increased, and she's always had a comment. So there's more than just 4 people or 4 operators out there that are not open to or would like us not to increase the fees this year. But I mean, it's a difference of $50 over 345 days. I think the license fee itself is hard enough for them to meet, and then you increase it a little bit and it just kind of rubs salt in the wound. And I can see where they're coming from when they're getting upset about the increase of the fees. It's just not a very good timing right now.
No, the other way of thinking about it is I'd hate to have to let a sanitarian go because we can't meet our budget.
Sure.
I mean, that's, you're damned if you do and damned if you don't. And so the best option I can think of, Joan, is to cut back on what we had proposed, similar to what they did with the water increase. You know, to try and keep some increase in there for our budget, but not something so severe that it compromises their ability to stay viable.
Yeah. I would agree. I mean, hopefully they would be willing to say, okay, you did make a significant sacrifice. We're okay with the nominal fee that's left over. I'm trying to decide in my mind, like no fee versus the increase that Justin proposed. Like, is it better to just say, okay, just scrap it? Because having, a $5 increase is really not going to do very much for us. So at that point, you just say, well, let's just cut the loss. Well, we wouldn't cut the loss. Let's just add to the loss and just take it on the chin for all the businesses because they are hurting.
Right.
Increasing the fees $40 or $50 for class 3s or 4s isn't going to do much to our deficit. It's not going to really knock it down that much. We have 70 class 3s.
Is it the class 3s and 4s that are going to get hurt the most, or the 1s and 2s?
The 1s and 2s, if you look at the proposed fees on the chart that I showed our 2021 proposed fees compared to what we could charge. We're only off by $40 for class 1s. We're only off by $40 for class 2s. We're off $120 for class 3s. We're off $200 and something for class 4s. So our deficit's being caused by our 3s and our 4s.
And they're not the ones that are really hurting, or they are? I don't recall what you just said.
The class 3s are going to be your full service restaurants with sit down service. Whereas our class 1s and 2s are going to be your retail gas stations and carry out locations. What's really hurting us is our vending machine operations. Right. And, our analysis says $85 is what we should be charging. And the law requires me an increase of 32% of the fee that we already have. And we're increasing it from $23.69 to $24.20, and that's 1 cent less than what we can max that out. And then our temporaries, which this is going to be all skewed when we do our 2020 analysis with our 2020 numbers, because we only had so many temporaries. And one of the problems with our temporary program is we issue one temporary for Grow for Good, but we do like 26 inspections and takes 9 hours to do. Right. That's what skews that number. This year, that's not happening. We have some barbecue operators that are pulling temporaries, and we're spending 1 to 2 hours every time we're in there. So we're not going over that number that we're charging. So we should be okay with that.
I'm willing to entertain a motion, board.
Long discussion.
I'd like to move that we suspend any increases this year.
No increase at all. Sorry, Louise?
I will second that.
So with no increase at all, Joan, is that going to hurt us substantially?
Well, it certainly won't help us. We'll have to take more money, I think, from the general fund to help cover our costs. Yeah. So,
you're aware of that, Jack, right?
It will be an easier pill to swallow for, when we go to city council and ask for appropriation, maybe then we can come back to say, hey, the reason why we're having to ask for this money is because we didn't increase fees. Right. So.
Just a rough calculation based on our class 3s and 4s, we're going to be missing out $7,000 to $6,000. So, which add that to the deficit.
So. All right, there's a motion on the table. Any further discussion?
I'm sorry. Am I able to put a motion to just raise it 50% of the proposed increase?
You can make an amendment to the motion, yeah.
Okay, I'm going to make an amendment to the motion to only raise the proposed increase by 50% of what we have.
Is there a second? Michelle, you wanted to say something?
Unmute.
Yeah, I'm with Louise. I don't want to raise it. I feel like mean, yes, it's $50 or $60 to them for the whole year for a business. But I feel like we are part of the city and we're part of the community. And I don't want, when we go into their business, I don't want them to be negative towards our health board. I don't want to have a bad reputation. I don't want the health board's coming again. Like, I don't want any of that negativity. I want them to be like, we stood by you, we helped you. This is a horrible time, and we're a community. We're going to help you.
Well, I really hope that feeling is expressed, because if we don't recoup from the general fund, we will have to lay off sanitarians because we have not recouped the money from those inspections.
But we would also have to lay off if all those businesses close and we have nowhere to inspect.
That's true.
I understand that like every penny counts right now, but I just don't see how $50 from
I
us,
know. That's where I'm like,
we're not causing them to shut down. It's a lot of other things.
And that's one reason why I try to put the cost per day to operate. With our fee increase, it's going to cost a risk category 4 $2 a day to operate with our license fee. And
yeah, to me, I'm with the others. If there was a way to do quarterly commitments so that, you know, if they end up not having it the last half of the year, we could work a deal. But yeah,
hands are tied on that one with the law.
Yeah,
would be nice.
Well, unfortunately, Emily, there wasn't a second to your amendment, so we're not going to be able to vote on that one. Is there any other discussion or amendments proposed to the motion? Here none, I'm calling the question. All those in favor of suspending an increase in licensing fees for fiscal year 21? Aye.
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 Opposed?
I am nay.
Abstentions? No, the motion carries. So we will withhold fees for service operations for the fiscal year 21 and
Withhold the increase.
withhold the increase, yes. And really hope that the businesses bounce back.
That for food services, pools, and body art facilities?
That was for food services,
okay.
Unless somebody wants to put a motion out for swimming pools and body art. Is there a motion to suspend or to change the
I
proposed?
feel like just as many people go for body art that they did before.
Okay. So then we'll need to do a voice name count on the resolutions for swimming pools and body art. Madam Secretary, we'll need a motion first for approval of the resolution, and then we'll need a voice count. Is there a motion to approve resolution, I forget the number. Help me, Joan, what was the number?
It would be resolution number 2021-002, acceptance for a resolution to increase local licensing fees for public swimming pools and spas in the Kent City Health District.
It's been voted on once. This will be the second reading and second vote. Is there a motion to approve the resolution 2021-002?
I motion to approve resolution 20-2002.
Is there a second?
I second.
Thank you. Is there any further discussion on the fee increase for pools under resolution 2021-002? All those in favor of the motion to increase, say aye.
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 Did we need to do a voice count on that?
Yeah, I'm sorry. We did need to do a voice count.
I'm sorry to interrupt. So we'll start with Chris Wolverton,
Aye.
Jack Amorine,
Aye.
Michelle Frederick,
Aye.
Emily Mattern,
Aye.
Louise Frederick,
Aye.
and Pam Ferguson is absent.
Correct. Okay. Hearing that, the motion carries to increase the fees according to Resolution 2021-002. The next resolution is 2021-003. Madam Secretary, would you read the title?
That would be the Kent City Health District acceptance of a resolution to increase local licensing fees for body art establishments in the Kent City Health District.
So that is the name. And is there a motion to approve?
So moved.
Motion.
Okay, Jack and Michelle, thank you. Is there further discussion on the motion? Madam Secretary, would you please call the roll?
Sure thing. Chris Wolverton,
Aye.
Jack Amorine,
Aye.
Pam Ferguson, absent. Michelle Frederick,
Aye.
Emily Mattern,
Aye.
Louise Frederick.
Aye.
So the motion carries.
So we will bring those back for their final reading in December. That's their second. Okay.
Correct. This was the second. We'll have one more reading in December for the final arbitration of those resolutions. So the first 001 was defeated at the second reading, so we won't worry about that one.
Right.
All right, we'll move on to rest of the business for the board. Pulling up my agenda here. All right, so could we please have the statistical report for October? It's in your packet, but Joan, is there anything outstanding you want to bring to our attention?
No, I think that you can see based on, year to date, 2020 versus 2019, and also just month to date in comparison that revenue coming in is down across the board in those areas. And again, due to COVID, some of it due to the fact that we couldn't go out to do some of those inspections, and we're trying to catch up on those now, but yeah.
Okay. Any questions for the commissioner regarding the statistical report? Okay. Joan, would you give us your health department report, please?
And I'll try to make this brief. In terms of the COVID-19 update, our case counts, I just counted prior to the meeting starting, we had 748, that's 748 cases. We have 2 known deaths. We had approximately 39 new cases come in today. I believe, our surge is continuing. I believe part of the numbers that we're seeing are due in fact to Halloween. When we talk with individuals, they do, although they won't say where, they will say, oh yeah, I was with friends on Halloween. So I think we're starting to see the ramifications of those actions and that. I did on Halloween go out, and after we did the compliance checks, which we didn't issue any type of notice to any of the operators. We were just there to support them in their efforts, just there to encourage them to continue to do a great job, which all of them were trying to maintain. We did go out after the bars had closed to look for some parties, and we were able to find some. So I did cite the first 3 individuals. I believe that they are contesting that citation, but that will go to legal, and they will be the ones that make the final say on that. So in terms of our contact tracing, we do have the 3 part-time staff. We have 2 individuals that work 12 hours, 2 individuals that work 20 hours, and actually they could all be working 60 hours a week. We did request the Ohio Department of Health to come in and help us do our contact tracing, and there for a while we had 6 additional contact tracers. So I want to say back in the end of September, early October, we had 6 additional people helping us. Our case counts were lower at that time. Now our case counts are higher, and they had to pull those contact tracers to other counties that are getting 200 cases a day. So I think everybody is fairly well behind. It's very disgruntling and very disheartening to not reach people on day 1 or day 2 after their test result is positive. Some people have shared with us, we didn't know we had to stay home with a positive test result. It's a little hard to believe in this day and age that people don't know with a positive test result, you need stay at home. But that's some of the stories that we're hearing. Again, we get a lot of no answers. We have a lot of people that have not set up their voicemail and they won't return our calls. We can't leave the messages, so we try to send them physical notices in the mail. Those are returned to us. So we are certainly not getting to 100% of those people, and I'm afraid that that's contributing to spread as well. Our public health alert advisory will update this Thursday. I believe will still stay red just based on the numbers of cases, based on what they're seeing in terms of hospital admits, ICU admits with COVID, and increased use of ventilators. So I don't think we're going to get out of the red anytime soon. In terms of testing and long-term care, we spoke to that earlier, so I won't cover anything more on that. We are holding 2 more testing events. There will be one on the 15th, this coming Sunday, open to the entire public. It will be 4 hours from 2 to 6 at Kent State University on the 2nd floor ballroom. And then we intend to hold one approximately 2 weeks after Thanksgiving. It will probably be a little shy of that, probably on December 5th or 6th, whatever that first weekend is, to try to catch those people. Okay, I don't mean catch in terms of they've done something wrong, but for people who are concerned that they may have caught the virus during Thanksgiving festivities, that they would have an easy way to get tested and find out those results. In terms of the tobacco grant, Mike continues to complete deliverables, is attending scheduled meetings, and audits are to be addressed under discussion items. That's one thing that he wants to ask the board in terms of that's still a deliverable, but we are experiencing COVID. So how do we ask for people to volunteer their time to go out and do these audits when there is some risk with that? So that is going to be a discussion item. Under food service organizations, the door reopened on November the 1st, the day after Halloween. It was to be closed on Halloween regardless of COVID or not. But and with the nice weather, I hope that they at least got these nice few days of people downtown. I know there was a lot of discussion that closing the Dora didn't decrease the numbers, but in my mind, we don't know if having the Dora closed prevented us from having even more. You know, we don't have that piece, but at any rate, the door is back. The door is back open, and we did talk about the FSO fee increase concern. Also, under discussion items will be some information technology platforms. We're currently using HealthSpace, and there's, I believe it's called Excella, is the new program that the state is looking into. But I believe until that's been decided by the state one way or another, which program they're choosing, we would at least need to look into a 1 to 2 year, or probably more like a 2-year contract to continue with HealthSpace, so we have some type of IT platform to do all that work in. Under housing inspections, the staff are really pressing to get all the units inspected that they can this year. There's no further updates with pool inspections because except for the hotel, many of the pools have closed for the season. And in terms of body arts, you know, we already had that vote in terms of the fee increases for that. So that brings an end to my report. And if there's any questions, I'll be happy to try to answer those.
Joan, with the new outbreaks that we're having, can you get, is there a guesstimate on ages? Is it all over the board, or is it young?
That's a great question, Jack. We're still seeing our median age at approximately 20, but I am starting to see more 43-year-olds, 57-year-olds, 63-year-olds, 81-year-olds. So we're having a smattering of those, but really by and large, the majority of our population is that, you know, that 19 to 25-year-old age group. I am starting to see more spread in families, not in the schools, but it is affecting K through 12 in terms of their spread in a family based on their activities outside of school. But then, you know, again, we have to look at quarantining those individuals once we realize, okay, now the student is ill. But we don't have any documented cases of a student-to-student transmission within the schools. I think that Superintendent George Joseph has done a remarkable job. He's very thorough and very measured. I think that he may be fielding a lot of questions about why don't we open 5 days a week all in person like many other surrounding areas. But I think he sees the numbers rising around us. He's taking that into account and wanting to be very careful with the safety of both the students as well as the teachers.
Good, thank you, Joan.
Joan, you said there were 2 deaths. Were they What age were the deaths of the patients?
I believe that one was in his 80s. There was a male in his 80s, and I honestly don't remember the age of the other, but it was, they were both elderly. They weren't a younger population.
So just,
I'm curious. Oh, sorry, Chris.
no, go ahead, Louise.
Are there any plans or talk about putting out any information to the public about how to be as safe as they can for the upcoming holidays? You know, I was kind of thinking about that for my own family as well. You know, we had all talked about even quarantining, you know, for 2 weeks so that we could get together for the holidays. Like, I wasn't sure if there was any kind of recommendations we could give to people to prevent further outbreaks.
The state has not come out with their final document, but Stark County has come up with a document. I think Rose may have alluded to that. That's very helpful. And we're planning on putting out messaging not only on social media, but I'll be doing a Swift 911 call. So anybody who signed up for that will get it as well. And we can put out some press releases, but I think social media probably reaches the most individuals. And the police department and fire department and city have been really great about sharing our messaging, since that helps boost, you know, and amplify what we're trying to get across. So yeah, we'll definitely be coming out with that. And I want to do that quickly because this Thursday will be 2 weeks until Thanksgiving.
Yeah. There was a kind of a definitive report, MMWR, last week that did a study of 2 cities. One was Nashville and another was a city in Wisconsin. And through 191 primary infections, they documented the age of transmissions and the mean incubation period. And as we have been anecdotally discussing, they determined that over 57% of infections to secondary comes from the age group 12 to 18. And then the age group of greater than 18 is accounting for 37% of the secondary infections. So as we thought, we've got a lot of asymptomatic, younger aged individuals who are basically spreading the virus. The other thing was the mean incubation period for almost all of those was 5 days. So good information coming out of that study.
One more question for you, Joan. What is the situation with Portage University Hospitals? Is the amount of are the amount of COVID cases taxing them?
Well, as Rose said, they are opening up their incident command to better deal with the surge. The surge at the hospital level, just like deaths, are 2 to 3 weeks behind what we see in public health. So we started to see cases rising dramatically 3 weeks ago or so, and now they're starting to get hit with that. They are okay in terms of PPE and spaces, and actually maybe Louise could even speak to this better. I think that they're managing adequately with staff, but that's the concern, is that staff are now getting sick, and so that we don't have the people to take care of the patients, and it's very concerning that they might have to go back to, back in March when they had to close down elective surgeries. And that would be devastating, because we know that there were real health ramifications from people delaying seeking care because of not having options or being told that they had to wait. So
right. Thank you.
They've fairly well been planning ahead a little bit as far as flu season and everything goes as well. We're all nursing staff, actually any staff that is in contact with any kind of patients, you're required to either wear a face shield and goggles now along with your mask. So they've at least kind of been considering, potential for exposure.
Yeah, I was glad to hear that they increased that level of PPE, even though cloth face masks are certainly fine for most of the community. For people at risk on the front lines, I think it's much more protective. So I was really glad to hear that they went that route.
And just as a side note, I got an email today from their infection control person saying that today UH Portage has the highest number of COVID patients since the start of the pandemic. Wow. So yeah, they are definitely stepping up.
Wow.
So yeah, I believe based on some data modeling that was shared with me that Mike actually put out on social media, about the 20th is when we'll see it really hit, and then it will continue to peak through December and remain high through January. So this will not be a short-term challenge for healthcare. It will be, a 6, 7, 8 week time period where they may be severely crunched. Yeah.
All right, anything else for Joan? Okay, we're on to
Hey, Chris, I wanted to bring up one thing just real quick. On pages 17 through 20 of the binder that I had sent out is a report that I did for the October 18th testing. We don't have to go through it because we've gone through enough reports and things right now. But if any board members had questions regarding that, I put together a couple of different charts. We did ask some questions about social determinants of health. So if any board members had any questions, you can send them to me, and I'd be happy to answer them.
Thanks, Mike. I actually really appreciate the analysis that you did. I do have a couple of questions, so I'll send those to you.
We plan with each of the subsequent testing to do that survey over again. So we'll hope to collect even more data with each one.
Great.
Hey, Joan, I did see that you have another pop-up coming like November 15th, or it was something. Is there any way for us to put it on the board in front of Panini's?
Oh, sure. I can ask Patty Long to do that. I think she did it last time.
Because I saw one of your concerns, or our delinquencies, I guess, is not reaching out to enough Kentites. So I didn't know, and that was my only idea to throw out there.
Yeah, no, I think a lot of people see things in that intersection if they're stopped for the light. So we'll definitely make sure that Patty has all the information to post that. Thank you.
And maybe also remind people to get their flu shot.
Right, because there will be a flu clinic along with that. So I mean, it's a great opportunity. I hope the public takes advantage of.
Yeah, super. All right, Mike, you want to take us through the discussion items?
The first one is
Sure.
Looks like first up is T21, and we'll make this quick. I wanted to pass this through the board because a lot of other health departments, a lot of other grantees are asking their boards. So the health department's done compliance checks every fall and spring for the past 2 years or so. And with COVID running rampant, I wanted to get some thoughts from the board members on if that's still a viable thing to do, to get somebody under the age of 21, along with, me and potentially one other sanitarian or 2 students and me to go and do these compliance checks. We have about 23 licensed tobacco retailers. That's down from 28 from when I started the program. So that's, trending in a direction. Make of that what you will with our recent discussion about local businesses closing. So it would be about 23 locations. The grant is $9,000 for the compliance check. So we would either be ignoring the $9,000 and simply not doing it, which the state has told me is an option, or we'd have to find a way to use that $9,000 for something else. And that's a lot of money. That's a significant amount of PARTA ads. That's it would take quite a bit to spend $9,000 on tobacco related, specifically youth tobacco related activities. So I just wanted the board's thoughts on that before I started to go find some students and then eventually take them into these businesses.
You are practicing physical distancing and people are wearing protective masks, and
that's correct, yes.
So the risk, and how long do you typically stay in each of the establishments?
Well, ideally, I have the student walk in and then I walk in a few minutes after, or vice versa, and they go up to go and buy something at the point of sale. Hopefully the person working denies them the ability to purchase a tobacco product, and then we both leave at the same time. There are instances where it would take a little bit longer, but it's typically no longer than 5 minutes. However, if you do multiple a day, then you start to get into that 15-minute risk period of time. Now, I could certainly plan this to do 1 a day. I don't know the feasibility of that, to have the same student do that for 22 straight days, 23 or so straight days, or however. There is a time limit to get this done by, I believe it's the end of March would be the end of that first quarter. So it's going to take a little bit of time to put together students, get a couple different CIs, get a few different interns, and then go into all of these locations. I did ask the state if we can split it up in half, if I could do perhaps the 10 worst locations or the most troubling businesses, and then split it in half and do $4,500 in other youth activities and $4,500 for those tobacco compliance check activities, but I have not heard back from the state on that yet.
I really would not want to put anybody at risk going around. So, you know, Joan, if we could spend $9,000 on other things, I would probably lean in that direction to protect people. But to Mike's point, if we can't, then hopefully we can split it 45 and 45.
Yeah, I think that we would end up leaving a substantial portion of that money on the table unused. I mean, I guess the good thing, based on the CDC definition of what close contact is, we could probably work to avoid that, to say you only have 5 minutes in this place and then get out, you know. But I mean, and again, there should be barriers inside of every location that we go to, and they should be wearing a mask. So, but again, you know, you have to have somebody who's a willing a participant.
Right. Other comments?
Yeah.
Well, I mean, like I've shared my opinion. I would err on the side of protecting our people.
Yeah. Yeah. So you think even if even if that would mean leaving money on the table, I would have a better sense of, you know, we didn't put anybody at risk. But maybe the state will come back and say we could divide it in some fashion as well.
I'm quite surprised, frankly, that the state is making us go through with this in light of COVID.
I know. I guess they must have determined it's not high risk enough, because it's, I don't know.
Well, they did leave it as an option. Several other health departments are not doing the compliance checks, whether they have, I mean, imagine Cuyahoga County, they got to do hundreds of these checks. So, and we're sort of only thinking about 22 or 23 of them. So I will reach out to some of those other health districts who are not doing them to see what they are using the money for. The difference is, in a county like Cuyahoga, $9,000 for youth outreach, you could do a lot more with that and cover a lot more ground than we can here in Kent and Portage County. So I will see what other activities the state will allow and make some sort of determination in December.
Well, the fact that your survey showed a lot of denial, or at least unwillingness to answer questions about smoking and e-cigarettes, it seems to me that we could certainly use more data in that area, and spending some of that 9,000 on a survey instrument or Qualtrics analysis and things like that might be viable.
Yeah, I mean, maybe that's something we could partner with the schools and try to, you know, try to get that survey out there to specifically see, you know, like, even has COVID influenced them to not use products, or do they still use them at the same rate that they did pre-pandemic?
Right. Yeah, I mean, yeah, okay.
Okay, so, all right, so I guess we'll wait and hear back from the state. And then the other piece under the discussion items is, as I alluded to in my report, about the health space renewal versus the Excella option for the sanitarians. I know that Justin did volunteer to, I guess, to work with the Excella program just to see, and then there would have to be an overlap time if the state did decide to go with that, just to see that it does things one for one. So at the very least, like I say, I believe that we'll have to have a 2-year contract for health space to take us through that time period. So I'm hoping that with a 2-year commitment that they would give us a fairly decent price, but if it's okay with the board, we'll look into that. I mean, those are things that we budget for.
Right.
Okay. All right. And that's it then.
Okay. Is there a motion for an executive session? I moved for an executive session. Is there a second?
I'll second it, Chris.
Thanks, Jack. This will also be a roll call vote, and this executive session should be very, very short, but you should have received an email from Joan
Yes.
a few minutes ago with the topic and some information that we'll share. And it's my hope that this would be a short meeting.
Okay. So for the roll call to go into executive session, Chris Wolverton,
Aye.
Jack Ammerine,
Yes.
Michelle Frederick,
Yes.
Emily Mattern,
Yes.
Louise Frederick,
Yes.
and Pam Ferguson is absent. So we
Thank you. We have now risen into executive session at 7:30. I would ask that